Today's video is about reinforcing stability through the body, especially when we're sitting, which is really tough. It's easy to collapse and not really realize how much you are collapsing or that you are collapsing. So you just want to kind of take what you already know or what you've come to know about your collapse, if you're weaker on one side or the other, or one quarter, like up here especially, the thoracic is really where a lot of our collapse happens when we're sitting. So just be aware of that, but also recognizing that through that stability system of the legs, is provided you can get your feet on the ground, it's really helpful. So again, we're going to start there at the legs. Think about the heel, pinky toe knuckle, big toe knuckle as that tripod on each foot. And then we have basically a tripod when we're in the middle here, like the pelvis. So you can imagine like your tailbone and your two legs as being a tripod, a big one there, okay? But the way we're gonna calibrate or recalibrate things is to be able to move a little bit and shift and try to feel how well you're stabilizing each side of your body, so you know where to kind of reinforce things or to stretch and mobilize things as needed or reset things. So thinking about those tripods of my feet, just making sure my feet are flat on the ground, which you can't see here in frame, but that's what I'm doing. And then next thing, rather than the big one in the center, when I shift to one side, I want to think about the hip. So with that heel, I'm corresponding to driving back into my gluteus maximus or my S glute in the rear here. I want to pull back into that hip. Slight little twist there, but really just driving straight back, kind of pissing back in that gluteal. I want to push down to my heel and feel that connection from my butt to my heel if I can. As I'm pulling over, I want to think about the knee coming in a little bit, not so much for movement, but to stabilize. So what I can do is actually take this is my right leg, I take my right hand and kind of put it just on the inside here, okay, and pull that knee in with some resistance to limit the movement, but also reinforce the stability here. So get those inner thigh, those adductor muscles there in that F plane, okay? I'm also pulling my shoulder blade back just to stabilize up top. We're gonna use that in a minute here. And then the last one is just that little bit of a hip hike here, okay? So what you wanna think about with this is that you're not emphasizing the lift of that so much from over here, because you don't wanna compromise my left side here in order to favor my right or reinforce my right. So I'm lifting from this outer hip as I push down, pulling in here to stabilize, also countering that out here. So it's like no movement, right? But tension and leverage from here, that creates like a fulcrum from that point to kind of lift this up, rather than this being weak, which oftentimes happens, and kind of scrunching like here to try to overdo it. That makes this tight, painful. We don't want that. So always lifting the whole body up, leveraging, fulcruming off of this, and those 3 points, inner thigh, outer hip, and the back and that glute with the 3 points in the foot, the arch, okay? So just feel that over there as I kind of pull back my shoulder blade here, okay? And I can do the same thing over here, and I can kind of go back and forth and kind of with that little bit of resistance and the leverage from the ground, kind of compare, see which side maybe is weaker. And also when I'm there, when I let go, like how much do I collapse onto that? Like if here, this is my stronger side, so the collapse here is pretty minimal. When I do this, that's my weaker side. And when I let go, it's a little more significant. I can feel like, whoa, it's like a bigger change. So I probably need to focus on, which I know I do, reinforcing this left side. And that tends to help if I'm sitting for prolonged periods of time, so I don't get as tight like in my hip or my low back. And that's just from previous injuries that I've sustained. But I can manage that on a daily basis, just knowing that and having those pieces in place. So then the next part coming up now is up here, and this is where, again, a lot of our weight is not supported directly, so it comes down. So we want to have a good base of support here, then we got to come up the chain. So I've already pulling this back, and so I can kind of lift and twist from my chest. Now the problem is it's kind of hard to isolate that with just the lower part, because our heads are so mobile and not very stable. And this is also maybe where you're getting some neck tightness and pain, maybe headaches and things from tightness here, lack of stability, okay? So it's not all about tightness. The tightness is because things collapse and are not stable. So if we enhance the stability, like I take my free hand now, because I'm over on my left, and put some pressure here, I can tension against that. So again, I don't want like my chin out, I don't want head up. Keep the chin a little tucked and just a little tension there as I stretch tall, and over here, and I can guide. So now with keeping that tension, I can keep my shoulder blade back and guide myself to rotate now in the opposite direction. Not too much, it's very slight, I'm really trying to feel through my thoracic. So I'm trying to kind of get a sense of my shoulder blades not moving, but I'm moving my ribs and my chest, and I'm getting a little stretch. I'm feeling the front here and the chest. Also maybe some movement and stretch back here, kind of almost detaching a little bit the shoulder blade from the body, or pulling the body away from the shoulder blade. And you can really feel as you lift and twist, it's like a stretch, like kind of stretching like taffy or something, and try to get that anchoring with the lift and twist and stretch. And then I can shift over here, again, pull in there, pull back there, feel it on that side. For me, this side's much easier, smoother, less resistance there. So I can tell, it's not too bad right now, but it can be that this is a little bit tighter, stiffer usually. And I can test that from time to time, just make sure that, you know, it's not too locked up, especially if I'm starting to feel painful tightness down here or wherever in the neck. That can really do a lot to reset things. And if I do it routinely, keep my brain, my body connected on that side, so that I'm doing a better job, even when I'm not thinking about it, to keep things connected and supported and stable.